All right, welcome back to the Now Morning Show here on TTT. It's 22 minutes after the hour of 7 o'clock. And it's our segment on Thursdays, Your Body and You. And we're going to be looking at the thyroid gland with Dr. Wendell Dwarka, who is an otolaryngologist, a head and neck surgeon. So let us just welcome Dr. Dwarka. Dr. Dwarka, thank you so much for joining us here on the Now Morning Show on TTT. It's a pleasure to have you here. So thank you for being here with us.
You're welcome. Thanks for having me.
You're most welcome. So, Dr. Dwarka, otolaryngologist, talk to us. What does that mean?
So, an otolaryngologist is a doctor who has specialized in basically the ear, the nose, and the throat, basically head and neck, with the exception of dealing with the eyes, the brain, and the teeth. We will deal with most things above the shoulder. And we do surgery in that area, and so most of us would describe as head and neck surgeons as well.
Okay. So, that's interesting because we just call them our ENT doctors and we leave it at that.
Sure. Yeah. I mean, that's generally how we're referred to, and most people would think that we deal with the ears primarily, but that's actually just one aspect of what we do. Most of what we do would often be surgeries, whether it's on the thyroid, whether it's on the tonsils, whether it's in the nose or the sinuses. So a lot of people don't actually understand the range of what we do.
Yeah. Right. So we're here to just clear up some of that for them. And as you mentioned, the thyroid, let us put some focus on that. What exactly is the thyroid?
So the thyroid gland is a small gland, about maybe 3 centimeters or so, and it lies in the lower part of our neck. And it has a very important function because what it does, it produces 2 hormones which help to regulate the metabolism of the body. And if it is that our thyroid is not functioning properly, then we'll understand clearly the benefit of having a thyroid there. So, for example, our thyroid gland might sometimes be what we call overactive or hyperthyroid. And in that case, what happens is that our body seems to be going faster than it should. We may end up having palpitations, our heart is racing, we may be sweating a lot. So we may be losing weight, even though you're eating normally and so on. And on the other hand, you can have situations where the thyroid is underactive, in which case you will have the reverse effect, where you may be quite lethargic and tired, you may be putting on weight, your skin may get quite dry and coarse, your hair as well get brittle, you may have different problems with menstruation cycles and so on. So those are 2 of the extremes of having problems with your thyroid.
Okay, but not only 2 of the extremes, is the other issues that will come with them that probably can lead to other conditions too, because if you keep losing weight, how does your body deal with that? Or your hair coming out or getting dry and brittle. So there are a lot of side effects to having hypo or hyperthyroidism.
Sure. Yeah.
Right. So Doc, let us look at if it is a hyper and those things that you mentioned, the losing the weight even though you're eating, that kind of thing. What are the effects of this on your health overall?
Well, generally speaking, if it is that you are hyperthyroid, and as I said, it's as though your body is on fast forward, you are going to be putting a lot of strain on the heart because the heart is going to be racing a lot of the time. And remember that the body would require periods of rest where the organs can have a time to rejuvenate. And so if your heart is constantly racing, then the heart muscle is eventually going to become weaker. And so there are problems that can occur with that. So by and large, if people are sweating excessively, they're feeling hot all the time, they're losing weight, they find that they're having a lot of palpitations. You may even have eye signs where your eyes seem somewhat bulging. You may have tremors. If you are having any of those signs, then you really should go and see your doctor, who would probably ask you to do a blood test to see if your thyroid is overactive. And in that case, you may be put on medication. If it is that the medication is not working, then there are other options, including things like surgery.
And what are the medications you'd use if you have hyperthyroidism?
Well, the medication that's used is typically something called neomercazole. There's also something called propranolol, which can be used if it is that you're trying to get the heart to slow down a bit. But most times it would be something called neomercazole. Yeah.
And what does the neomercazole do?
Well, it's basically helping to reduce the amount of, or the effect of the thyroxine which the thyroid gland is producing. So it allows the thyroid gland to work more efficiently by bringing the value of the thyroxine back to within its normal range.
Well, would it keep it down over a long term? Would the thyroid go back to its normal function?
In most cases, it will need to be, that patient would need to be on it for several years. Generally speaking, if it is that it's not controlling patients well, then they may be referred to surgery. But by and large, endocrinologists who deal with the medical side of that condition would be the ones who would help patients to bridge that gap and to keep things within control.
And so, I have to ask you this, Doc, is hyperthyroidism different from hyperparathyroidism?
Okay, so we're talking about two entirely different things.
Okay.
The parathyroid gland is a small gland. In fact, we have four, in most people, we'll have four small parathyroid glands, which are located behind the thyroid gland. And those parathyroid glands help to regulate calcium and phosphorus within the body. So while they are both near to each other, they have two entirely different functions. And when anything goes wrong with either of them, it presents in different ways entirely.
Okay, so when you have a hyperthyroidism, what are the physical symptoms you look for? You mentioned the bulging of the eyes. What else? Would you get that bulge at your throat as well?
All right, so I think what you're asking is sometimes you will see patients who have quite a large neck lump.
Yeah.
And we often, when we see that, there are different reasons that might occur. Sometimes they may occur because the thyroid is overactive or underactive. And in either case, you can get the thyroid becoming quite large. And in some cases, you may see a bulging because of a growth within the thyroid gland, something called a nodule. And in most cases, those nodules would be benign. But in some cases, you will have malignant nodules, which will cause the gland to enlarge. So a large thyroid, or what is commonly referred to as a goiter, is something which you can be due to either hyperthyroidism, hypothyroidism, or because of a growth within the thyroid gland.
Right. And Doc, what are the risks to surgeries for hypo or hyperthyroidism?
When someone is having surgery, we would sit down and discuss with them some of the main problems that might occur. And the predominant issue there has to do with a nerve which supplies the voice box. And that nerve, in fact, we have it on both sides, the right and the left side. And those nerves are running right behind the thyroid gland. So during surgery, what we try to do is to identify those nerves and to preserve them, because if there was any trauma to those nerves, then one may present with hoarseness. In some cases, the hoarseness may be temporary. And in some cases, depending on how much trauma was sustained, it could be a permanent problem. So by and large, when we are doing that, that's the main thing we are looking for. We also try to...
And what our results look like? Do we normally have a lot of people with that hoarseness that persists?
It would, well, there are several factors that would influence that. One of which would be how often that surgeon is performing surgery. And obviously the expertise of that person would determine to some extent the risk involved. And also the size of the thyroid that is being presented. So if patients come with a very small thyroid gland enlargement, then the risk is minimal. And the larger the thyroid is, then the risk will increase. So by and large, we would prefer to see patients with smaller rather than bigger thyroid glands.
Right. And is there some kind of measurement as to, because I think a lot of times people don't even know what's happening with them, to even know when they're at risk for these other, symptoms or effects that can happen as a result of hypo or hypothyroidism. So I was wondering if there is a measurement, so to speak, that if somebody is aware to say when we need to get to surgery.
Well, you're asking a very specific question there regarding surgery. And the decision on surgery is based on several factors. Among those would be how well controlled the patient is with medication, but also there is the issue of the size of the thyroid. Because the thyroid sits on what is referred to as a windpipe, if the thyroid gland is quite large, then there may be some degree of compression of that windpipe, and that would result in some difficulty with breathing. And so patients, often when they're lying flat in bed, might feel that it's resting and squeezing onto the windpipe, and they find that they're having some difficulty with their breathing. But again, depending on the size, it could be something that's occurring even while moving around during the day in an upright position. Other than that, behind the windpipe, you have what is referred to as the esophagus, which is where we swallow food. And the esophagus, if that is compressed, it will make swallowing somewhat difficult, particularly solid foods. So those are some of the symptoms of what might occur if it's enlarged and what may bring people to having surgery. Apart from that, there are some who may not like the sight of this lump in the neck, and so for cosmetic reasons, patients may also prefer to have it removed.
Right. So, but Doc, you shared so much with us just now, because I know that there might be somebody out there who may be laying down and wondering why they're feeling, that compression and why they can't breathe properly, or even when they're eating, why they're not able to swallow, in a very comfortable way. So I'm happy that you shared those with us, because now if there's somebody out there listening and they're having these effects, they can know that, listen, I need to see an otolaryngologist. I need to go and see Dr. Wendell Dwarka, so to speak.
You don't necessarily need to see me, but I suppose any otolaryngologist would be fine.
Right, Doc. So, I think you've shared a lot of what we can look for, whether it's the bulging eyes, whether it's the breathing, whether it's the difficulty in swallowing, whether it's the bulge in the neck, losing weight, gaining weight, lethargy. I think we've covered a lot of what we can look for to say, okay, we definitely need to see an ENT or head and neck surgeon, to find out what's going on. So you say a blood test. Is there any other way to check to see if, your thyroidism is overactive or underactive outside of a blood test?
I mean, I know you are sort of focusing on overactivity and underactivity, but I would say that most people would actually present with a nodule in the thyroid. So it may be something that they've noticed quite accidentally. They're just looking at the mirror, or someone is looking at them and saying, hey, what's that lump you have in your neck? Because nodules are actually quite common. And in fact, patients over 60, at least 40% of those patients would present with a nodule. So if it is that someone is seeing a lump in the neck, whether it's small or large, they will need to see their doctor, who would not necessarily order blood tests, although that is important. But what you would probably be asked to do is to get an ultrasound, and that ultrasound would be able to identify whether your thyroid gland is enlarged, whether you have a nodule, whether it is that this nodule is single, whether there are multiple nodules. And then based on that, we would take the discussion further and decide what will be the best way to treat this patient.
And if somebody has a surgery, whether for nodules, hypo or hyperthyroidism, are there any chances of these things reoccurring?
No, if it is that you've had an operation to remove the nodule, then it's not going to reoccur. Reoccurrence is something I guess we would more associate with patients who have thyroid cancer. And even so, the reoccurrence is not necessarily in the thyroid gland, But what may happen is that you remove the thyroid because of, let's say, of a cancer, and let's say some of those malignant thyroid cells have spread to nodes which are located in the neck. And then if, for example, those cancer cells haven't been treated adequately, then you can get some degree of recurrence in the neck where those nodes become enlarged. But as for the thyroid per se becoming or having recurrence, no, that's not normally the case.
Right. And after, if somebody has hyper or hypothyroidism and they remove that thyroid gland, what are the effects, the long-term effects of that, of not having that thyroid gland? Will you have to have medication for life? What happens?
All right. So it's basically a situation where patients will then have to have the hormone that the thyroid gland is producing. That hormone would require replacement. And that is done by giving them a tablet called thyroxine, which they would then take every morning for the rest of their life. And the dose of that would vary dependent on the patient's requirements. But it's just like having high blood pressure or diabetes, where you have to decide, right, for the rest of my life, I have to keep taking these tablets in order to keep things under control. And that's what patients do. And there are a large number of people who've had surgeries and who are on thyroxine, and it's just become a way of life for them. So that's not an issue.
And in terms of cost of surgery, is it very expensive?
I guess it would depend on where, who's the surgeon, which institution you're using privately. But at the end of the day, for patients who are not able to afford financially, it's done regularly at any of the general hospitals. So that shouldn't be an issue for any patient.
Right. So they can choose not to go privately and go to the general hospital to have it done. Do you think we've covered all the bases, Dr. Dwarika?
I mean, I would say that the one thing I would recommend to patients is that don't wait till your thyroid gland has gotten so large that it now becomes more difficult to treat it surgically. And the other aspect is that sometimes if it's growing really quickly, we need to be able to identify fairly rapidly whether it's a malignancy. And because there are some types of malignancies in the thyroid which have a really bad prognosis. So it's important.
As I said, Dr. Dwarika, my apologies, is that a lot of people don't know what to look for. So that thyroid gland may be growing. And they, you know us, it's obia, it's something that we ate, it's allergies, and we come up with all these silly excuses for what's going on with us, which is why I focus so much on what are some of the things we can look out for ourselves to say, okay, I definitely need to go and see an otolaryngologist, to check out what's going on with me. So I would really appreciate if we could go over some of the symptoms or some of the signs that are there that we can look out for to say we need to visit the doctor.
All right. So if your thyroid gland is overactive, you may not necessarily see an enlargement in your neck, but you may have symptoms where you're sweating excessively. You often find that it's very hot when most people find the temperature is normal or adequate. Sometimes you may find that you're having a lot of palpitations, your heart is racing, you're losing weight unnecessarily, and you're not even attempting to do so. Or on the other hand, you may find that if your thyroid is underactive, again, you may be finding that you're quite lethargic, you're tired all the time, your skin is getting dry and coarse, your period may be somewhat irregular, your hair may become brittle. So those are some of the symptoms that I would suggest you go and see your doctor for. If, of course, you do see a lump in your neck, a swelling, however large it is, then absolutely that's something you should be going to see a doctor for.
Right. I'm writing down all of them. I want to make sure that, because sometimes when you do these programs, somebody may call to ask, what is this or what is that? So, Dr. Dwarika, so let me ensure that I got it right. If you're hyperthyroid, if you have hyperthyroidism, you may have sweating excessively, palpitations, losing weight unnecessarily, and then underactive thyroidism, It's being lethargic, tired, dry skin, poor skin, irregular period, hair might be brittle, and the lump in the neck. But we'd have the lump in the neck for both.
Yeah, yeah. You can have a lump in the neck, whether it's hyper or hypo,
Or
your
hypo,
thyroid may
yeah.
actually be normal. Yeah.
Yeah. But, and we didn't speak about that. What is normal thyroid? Like, when it's normal, what happens?
Well, if your thyroid is normal in both in terms of its size as well as the hormone levels, then you wouldn't have an issue. Your metabolism would be normal. You would have no swelling in your neck, so life would be quite normal for you. So there's no
Yeah,
issue with that.
I think that's what I'm asking, the benefits of having a normal thyroid, you know.
Yeah, well, as I said, the thyroid is predominantly there to regulate our metabolism.
Yeah.
So if our metabolism is affected one way or the other, either it's going too quickly or too slowly, then that's a problem. So
And you
in
know,
essence, that's one.
I want to ask this, Dr. Dorka, just here thinking about it, because we're being told now that, you know, our immune system is in our gut, and, you know, most of our diseases are produced from our gut. So if the thyroid is affected, could that also, you know, affect what's happening in our gut and cause any other kind of conditions?
Not that I'm aware of. I mean, in fact, I didn't quite get, I just missed something what you said there.
I was just
Immune
wondering if there
system
was
is
any,
associated with the gut.
no, I was just wondering if with the slow metabolism, if that can also contribute to what's happening in the gut.
Not specifically. I mean, there may be a small influence there, but I don't think it's going to be a major problem there. If you're having some issue regarding your intestinal function, then you probably will need to see a gastroenterologist for that.
Right. Dr. Dork, I want to thank you so much for sharing your wealth of knowledge with us this morning. I am positive. Well, I've learned so much, so I'm hoping that the audience would have learned something and, you know, to know if they need to go and get checked by an otolaryngologist. So thank you so much.
You're welcome. Thank you.
All right, that was Dr. Wendell Dwarka talking with us about thyroidism, hyper or hypothyroidism, and just what to look for and to know when you need to see an otolaryngologist. We take a break and we'll be back with you on the Now Morning Show.